All right, welcome, ladies and gentlemen, and thank you for joining us for the 11th edition of the Fireside Chat. My name is Garrett McLaughlin. For those of you who are new to this series, the Fireside Chat is a conversational webinar where we connect with some of the top professionals in the running health and medical communities. This week, we have Dr. Wenzel, who is a medical doctor and owner of Brentwood MD in Brentwood, Tennessee. Before we get started, let me cover a few quick housekeeping items. First, do us a favor and silence any technology around you, just to make sure you get the most from the chat today. Second, I highly recommend asking questions. Of course, there'll be specific items we will cover as was outlined in the registration, but you're welcome to ask anything that will help you positively impact your health and wellness. Feel free to drop a question in the chat box now or at any point throughout the Fireside Chat if something comes to mind. Lastly, if you cannot stay for the entire chat for whatever reason, or you just want to reflect back on this content at a later time, I will be sending the replay of this to you tomorrow at 11 a.m. Eastern time. Make sure to check your email and especially the spam folder since it sometimes ends up in there. Without further ado, Dr. Wenzel, thank you for joining us on the Fireside Chat. How's everything going today?
Great, man. Happy to be here. Thanks, Garrett.
Yeah, no, good to have you. I know it's been a little while since we connected last. So I've been seeing a lot of different content from you on the podcast and LinkedIn and different areas. So this was something that I thought was well needed and kind of a recurring theme with several of my clients. So definitely happy to have you on here to hopefully expand into this a little bit more for us. And
yeah, happy to be of any help I can.
So as we get started then, if you can give us a little input on your background, why you created Brentwood MD and just kind of what transpired over the years.
Yeah, I mean, I think the short version is I'm a family trained doctor. After finishing my chief resident year, completing family medicine residency, I promptly took 0 family medicine jobs because I was really disheartened and really didn't know what I was going to do with my medical practice, but knew it wasn't going to be family medicine in the traditional way. So I started working in the ER, did that for 13 years, was managing a department for the last 4 years. And about 5 years ago, I came across the concierge medicine model, which essentially allows me to be perfectly aligned with my clients from day one. So we have similar goals, values, objectives, and we partner on a much smaller, more intimate scale than a traditional model. The traditional model, your family doc might have 3,000, might have 5,000 patients that they're taking care of. I'm capped out at 200. And so there's just a level of kind of relationship that develops in that kind of world that is rare and incredibly fulfilling. So within the context of that relationship, about 4 years ago, I got really, really deeply interested in hormone optimization, originally from a treatment of obesity and metabolic disease standpoint. But now in my current practice, I deal with a lot of high performance, highly successful type folks who are very interested in prevention, reclaiming peak performance physically, mentally, emotionally. And there, when you really get under the surface there isn't a lot of separation between physical high performance, metabolic high performance, emotional, psychological high performance. And so these things, hormones are one of the pillars. And so it's an area that I'm deeply, deeply passionate about. And uniquely for women, there's a lot of suffering that is unnecessary. And I hope to maybe be of some value with this talk for the women who are listening, who this may resonate with.
Yeah, that sounds great. And I think that to get us started into the content, what exactly, as you say hormones, what does that exactly mean?
So hormones are a difficult subject to really get any traction because they are complicated, confusing, and controversial. We as in the medical community like to discuss things in an overly simplified way as if they exist in a vacuum, that, you know, these hormones, that we can just in isolation discuss them, but they're wildly complex, infinitely interwoven, which then leads to a lot of confusion. There's also been a lot of negative talk around it that could be a whole nother conversation, specifically rooted in the Women's Health Initiative, which was a the largest and first of its kind women's health study in 1992. There's a lot of problems that have come out on the back end of that kind of create this kind of controversial nature. But nevertheless, it is something that if a woman identifies with the following: I am underperforming what I'm capable of, and I'm interested in a higher, more productive, more powerful, more vibrant version of myself, you have to be able to at least have the opportunity to talk about the neurohormonal environment, because you could do everything else right. And if your nervous system is not firing and your hormonal system downstream, all the running and exercising and dieting, that's like the first domino to fall. But what you're trying to do when you train, what you're trying to do when you eat, is trigger the optimal hormone response so that you get the ideal outcome. And you know this as well as I do. If you don't have your hormonal environment optimized, it's over. Like, I mean, you're just going to continue to decline no matter what you do. So this is a major, major thing, presupposing you have the ambition to actually reverse chronic disease, reverse metabolic disease, maintain a high level of performance in your fourth, fifth, sixth, seventh, even eighth decade of life. This has to be what we're talking about.
Mm-hmm. So I guess a big question then from the beginning here is how often is this being missed? I mean, so many people come to me and saying, Garrett, I want to run faster, run longer, exercise, lose weight, and all of these things. And that's their first step. If they are not noticing any type of symptoms of some type of hormonal imbalance, is it possible they're still struggling with this? Or is it okay to go to those next steps without first exploring hormones?
That's a really, really good question. I think the easiest way to answer that, and I don't know that this would answer every single person's unique situation, but at a high level, I would say, if you don't identify with underperforming, you probably could table this discussion. Mm-hmm. But if there's something about your physical performance, whether it's the times, the strength, how you feel, how you recover, the stamina, your mood, if all of those things are hitting, then this is an interesting talk. Table it until you become symptomatic. You will eventually start to identify with one or all of those, or some combination of those types of symptoms that are typically experiential. That's usually the first sign that hormones are suboptimal. I think physical findings, lean mass atrophy, difficulty controlling belly fat, visceral fat, decreased sleep, decreased mood. I think those are late findings. I think someone with a hyper amount of body awareness who's very performance driven, I think the first thing they're going to notice is somewhere in the performance metrics, either in the ability to achieve or what it's taking from you to achieve or the recovery time. There would be an early indicator. And then I think it would be worth exploring.
Okay, that's interesting. And so when it comes to women specifically, I know an interesting conversation I have with a lot of women, not obviously diving into the topic in depth because it's not my area, but just asking those questions, seeing if they're talking to their healthcare providers about this. Is a woman's journey going to be much more unique and specific than a male's? And if you can walk us through that.
Oh yeah. I mean, I think first one would need to understand that the feminine experience is far more complex than the male's experience. But that's by design. I mean, women have the ultimate human superpower, and that is the ability to create life. And the way that happens is all through our neurohormonal environment. I don't have the same neurohormonal environment that my female counterparts would have. And so it's by design more complex. Men have a neurohormonal environment, but it's a little more straightforward because we don't have to manage creating another human being, managing pregnancy, delivering that it's the ultimate superpower. Problem is when we're done having babies and creating other humans, we still have this complex infrastructure of hormones and nervous system to manage. And so a woman's experience tends to be far more different. I think as we look at a prepubescent girl, once she transitions, whether that's 11, 12, 13, into her first period, she is now a premenopausal, fully mature, post-puberty woman. Her hormonal experience remains relatively steady. There are some exceptions that hormones are involved, specifically thyroid. We'll talk about thyroid in a subsequent slide. But where it gets really interesting is when, and all these hormones are coming from the ovaries, and the ovaries are creating this hormonal engine in order to facilitate human creation. And what happens is when you hit menopause, those hormones shut down because the ovaries shut down, they just stop. And many women, as they approach menopause, kind of get close and then back up and then get close. And this is called perimenopausal or around menopause. This, for many women, can start as early as 40 to 50. On average, women hit menopause around 55. That's by no means like some standard of like, that's what everybody's going to get, but that's kind of on average. And then the experience, once you're in menopause, it's binary. There's no coming back. The ships have sailed. The feminine experience post-menopause is one of hormonally barren. And there are massive, massive health consequences for women who live in a hormonally depleted environment: bone health, brain health, breast health, cardiovascular health, all of these things that in your more vibrant premenopausal state, you're absorbing the benefit of the hormones, and then they just disappear. Experientially, you hear about hot flashes, but I think as men, we kind of downplay the impact that is, but that's just the beginning of the suffering. Those eventually go away as you adapt as a woman to no estrogen, but like there's a ton of downstream health consequences for women who don't have the adequate optimal hormone levels.
So one thing you mentioned there, you mentioned bone health, and I think of like we need to be active and doing the right things early in life to build up that bone bake to then be more successful later on. Is that something similar with hormones where we need to take more of a proactive approach because we're going to deal with those consequences regardless, or can we really make some good strides later in life even if we don't recognize it until that point?
Yes, it's a good question. You certainly aren't going to make any strides without a very intentional strategy. Post-menopausal, it does become harder and harder, but it's not impossible. A woman's prime season of life to lay down strong bone is before she hits menopause, but you could still achieve increased bone density post-menopausal if you have the right training regimen and you have the right hormonal environment. And something of interest, because I know you do a lot of running and I know you work with a lot of women who run, running does not build bone density. Mm-hmm. Matter of fact, women who run a lot who are light are uniquely vulnerable to osteoporosis. Small, light, strong women may not end up with heart disease, but at 70, they trip over a rose bush and they'll fracture their hip because they're so light, their bones don't ever become dense. A 290-pound woman may end up with heart disease, diabetes, and kidney disease, but she'll never break a bone because her bones are steel, because that infrastructure has to be strong. 120-pound athletic supermom, like she may not end up with the heart disease downstream, but you need to be really, really concerned about bone health, which is why even for runners, strength training is loading your core, your pelvis, your hips, your bones. So big loaded movements are super important even for runners, for bone health.
Right. Yeah, it's interesting you said that's something I talk about a lot in the private Facebook group that I have, because so many people go to running for a bone building strategy, but in reality, it's these other things like strength training, hormone optimization, those things, which I think need to be the foundation. So as we get on here, you mentioned thyroid a second ago. So, and this is something I hear often from a lot of people. could you dig into the thyroid specifically? So this is a gland that secretes hormones, and is there multiple hormones that come from the thyroid, or a few in particular we need to focus on?
Well, the thyroid gland is a little, it's a thin endocrine gland located on our neck here, that secretes thyroid hormone. There are different variants of the thyroid hormone, but they're all thyroid hormone. And I will just start by saying it is, and this is coming from a guy. Now, look, I'm biased. Like, this is the gospel according to Dr. Wenzel. So, like, take this for what it's worth. But, like, I often say that the most mismanaged disease on the planet is diabetes, and I stand firm by that. The second most mismanaged disease on the planet is subclinical hypothyroidism. Subclinical meaning it doesn't meet the clinical diagnosis criteria, but yet the woman's experience is such that she fits every criteria of low thyroid and would greatly benefit from optimization, but she's told she doesn't qualify because it's not low. And the spectrum of normal is so vast that many women are in the middle or lower quartile of the normal range, yet exhibiting every symptom of low thyroid, and would greatly benefit from moving into that upper quartile of normal, or more optimal, for symptomatic relief. And thyroid is wildly important, especially in the feminine experience. Men seem to be far more tolerant of suboptimal thyroid. In other words, their experience is that they don't sense it. A woman, however, if you got a room full of 100 women, just completely off the street, one of the hot topics going around is going to be, do you have thyroid problems? Are you taking thyroid? Hey, let me borrow your thyroid. And I feel better when I'm on thyroid, but my doc says it is in the conversation of most all women. On the disease side of things, we see it about 10-to-1 women to men. So if I had a thyroid only practice, it would be almost all women. And I'm not smart enough to know exactly why that is. All I know is that thyroid is intimately woven into things like temperature regulation, metabolism, monthly menses. Your monthly cycle as a woman is absolutely thyroid disease. One of the first places it shows up is out of the blue, irregular periods, difficulty controlling weight, thin hair, poor complexion, constipation, fatigue, brain fog. These are like a list of symptoms that so many women would be like, yes, yes, yes. And so we hunt for thyroid in every woman, just to see if there's an opportunity. And we uncover lots of what I call subclinical hypothyroidism. And I would just say, because I know we have a short window here and we're going to cover several other things, if you identify with any thyroid type symptoms and you get told you're normal, that doesn't mean there isn't something there that could be tweaked. I hate the word normal. Normal is another word for common or average. I'm looking for optimal. And the goal with hormone optimization is to become optimal. It's kind of like, I always say for thyroid, it's kind of like, I feel like the world is moving by fast. I'm sluggish. I'm a little bit lethargic. I'm a little bit, all of these symptoms. And I got told, using a car analogy, I'm going 45 miles an hour. And I got told 45 miles an hour is a normal speed. Mm-hmm. Yeah, it is officially within the realm of normal speed. Mm-hmm. But if you're running down the highway, that is a suboptimal normal speed.
Right.
Now, if you're going 45 in a school zone, I would say that's probably a little bit too fast and you're absorbing some downside and some risk. That's a little bit too fast. So optimization should be the goal. And the way we know you're optimal primarily is, how do you feel? And so how you feel should be driving a lot of the thyroid discussion. And if you feel like some of these symptoms are something that resonate with you, I would search for someone in your area who understands thyroid optimization.
Mm-hmm. So do you see a lot of times either healthcare providers not taking into consideration the patient and their experience and only looking at like specific panels and saying you're normal, even though you're feeling 100%. We're going to disregard it?
Yeah, and it's not look, I've gone through the whole process of being like angry, and then like, I'm at the place of acceptance here. I mean, my colleagues they're seeing 40, 50, sometimes 60 patients a day, in an 8-hour workday. They're moving as fast as possible. Unless there's red numbers popping out, they're not going to dig deeper. You're going to get your normal move on. And by the way, if you complain enough with thyroid, you'll end up on Prozac. That's what ends up happening is that they're like, well, maybe you're depressed.
Okay. Interesting.
So, and I'm sure that there are women who are going to watch this and be like, oh my God, how does he know?
Right.
Yeah, I mean, if you don't know what you're hunting for, you're going to take a quick look. And unless something's jumping out on fire, you're going to move on to the next thing because you've got a line full of other patients to see.
Mm-hmm.
And your average primary care internist, family doc, not only are they seeing 50 people a day, but they're dealing with 3, 4, 7 issues per person. They've got to go fast. They don't have the time.
Right.
If I have 4 appointments in a day, that's a busy day.
Mm-hmm. Yeah.
I have time to go deep.
And so as we go, did I go, there we go. So testosterone, I think this something as, and you say first, not just a male hormone, something predominantly male, but obviously has huge implications here in other areas, muscle fat, visceral fat, bone health, cardiovascular. Is this something that I would think women tend to overlook to a degree just because we perceive in society as a male thing?
The average woman, when I'm like, yeah, she got a real opportunity here to optimize your testosterone, they're like, no, sir, I'm fine. That I don't want to turn into a boy. And this is a real big misconception. I mean, it is such a critically important hormone for the feminine. It's a critical hormone for the human experience. Men need tremendous amounts more. Women need a fraction of what the masculine experience needs. But, when we talk about bone health, we talk about strength training, we talk about estrogen, and then post-menopause, when you lose your estrogen, you lose your bone density. Meanwhile, testosterone is 3 times as potent as estrogen in laying down and stimulating new bone growth. And one of the most universal things for high-performing, very high-drive women is I can't get my muscle tone where I want it.
Mm-hmm.
That's a testosterone problem.
Mm-hmm.
I've got belly fat that I can't get rid of. My arms aren't as tight. My quads, my glutes are atrophying. My shoulders feel weak. This is a testosterone problem. Mm-hmm. My libido's fallen off. I don't have the stamina through the day, my drive, my creativity. And, most women, especially women in their late 30s, early 40s and beyond, if they otherwise are highly driven, athletic, fitness-oriented career, like they're just high drive, there's probably an opportunity to look into testosterone. In the premenopausal world of women who are probably listening to this is why I put these 1-2, is thyroid and testosterone together, just millimeter tinkering, just like you would maybe, Garrett, watch somebody's gait and be like, your heel strike is this is really what I'd like you to do, and you're not on your great like, it's like there's nothing really, really wrong, but like better is better. And like, if we want to do this and not kill your hip in 14 years, I need you to be focused, like those things. I don't know exactly what you look at, but I know you look at those things. But it's those kind of things. Testosterone is a real important for lean mass, fat, visceral fat, insulin sensitivity, so fighting metabolic disease, bone health, cardiovascular benefit, and not to mention just the mood and kind of other vitality-based metrics, libido, obviously, those things. But like, this is not about turning women into men. This is about turning women into the most vibrant, feminine, powerful version of themselves. And testosterone is absolutely at the core.
Yeah, that's interesting. Yeah, interesting is something I don't obviously hear about a whole lot. So good to hear you touch on that, because I think it will kind of turn the light bulb on for a lot of people.
Oh yeah.
And then as you get into progesterone here, again, its importance and obviously something I don't hear about as much, and how that impacts people.
Yeah, well, progesterone is most famous because it's the hormone of pregnancy. So progestation, it is what allows pregnancy to be maintained. Matter of fact, a lot of women who have maybe are listening and have had trouble holding on to and preserving a viable pregnancy, subsequent pregnancies, they likely got progesterone shots because their body is just inefficient at making adequate amounts of progesterone to maintain pregnancy. Outside of pregnancy, it's incredibly important for regulating a woman's cycle. It's the back half of, estrogen is the front half, progesterone is the back half, each and every month. It's stabilization of periods. Young women, when they have abnormal periods, they get put on birth control in order to stabilize their periods. It's because they go from no hormones to this estrogen dominant world. They need the progesterone to kind of calm things down. It's the antidote to too much estrogen. It is an incredible anxiolytic. It's almost like nature's Xanax. When women have, on average, when you have a good pregnancy, it's that euphoria of pregnancy, kind of like my hair is good, my skin is good, all is well in the world. I'm creating a baby. Like I feel good, I'm sleeping good, I'm feeling creative. That's that kind of euphoria that progesterone creates. It's wonderful at creating a very tranquil evening and sleep, mood, PMS. Much of PMS is a hyperestrogen. Another way of saying a progesterone deficiency. And it is protective against breast and uterine cancer, which tend to be stimulated by overestrogen states. So in practice, a premenopausal woman who has abnormal periods, horrible PMS, hormone-induced migraines, progesterone can be a lifesaver. Bad sleep. It's safe for all women to take once they've hit puberty. So, I have a lot of women who take it every day at baseline just to kind of help with mood and sleep. And then during PMS, they might double and those kind of things. It's safe even if you get pregnant. So it's a real great hormone to be thinking about if some of these symptoms are kind of going on. Yeah, that's what I think about progesterone.
Okay.
But it's really underrated. It's super, super underrated.
And then as we dig into estrogen, obviously one of the things now we're hearing about so much and so often, and something I think about from a, I guess, bone absorption standpoint with runners and active individuals. Could you run us through just a little bit more background on that?
Well, estrogen is kind of the most famous and most significant hormone in the feminine experience, right? It is what differentiates a 12-year-old boy and a 12-year-old girl on two different paths. One of them gets exposed to large amounts of testosterone, the other one gets exposed to large amounts of estrogen, and their bodies change respectively. And the beyond kind of the male-female kind of differentiation, women who are premenopausal, in other words, who have high levels, optimal levels of estrogen, when you look at the risk for cardiovascular disease and bone disease, it's virtually unheard of to get cardiac event prior to 55. There's nothing magic that happens at 55 other than on average, that's when women hit menopause, which means they have no estrogen. When you look at 55 and on, women actually outpace their male counterpart with cardiovascular events. Estrogen is incredibly cardioprotective. This is why a lot of women will come in who are premenopausal, healthy women, their HDL will be through the roof. And they're like, I don't know what it's from. I eat pizza and drink beer. And it's like, well, you're lucky and you're being protected by your estrogen. Once you hit menopause, that's gonna be a real problem. It's very, 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 very famously involved in bone health. But again, still not as potent as testosterone. You really need them together if you want all hands on deck for bone density, which I think would be useful for your crowd.
Right.
Because I bet on average they're smaller, more fit, and which lowers metabolic disease risk, but it raises osteoporotic risk.
Mhm.
And so it's the give and take. Like, these are diseases of humans. If you live long enough, things start wearing and tearing, and based on what trajectory you are, you're going to be uniquely vulnerable to different diseases. And osteoporosis should be, I mean, it should be up there with cancer in your crowd, because it's still a top 5 killer of women that no one talks about.
Right.
And you can't just hope. Hope is wonderful. Hope is a wonderful thing, but it's not a strategy.
Mhm.
You know, you've got to have load bearing. You've got to have optimal hormone environment. You got to be measuring, whether it's DEXA scans. You've got to be making sure you are maximizing your opportunity for bone density, because you break a hip, 50% mortality in 12 months.
Right. I've heard that. That's
You will
staggering.
die. You will die 50% of the time within the year after you break your hip.
Mhm.
And we all know someone, pneumonia, pulmonary embolism, they get UTI and septic. The human body was created to be in motion. And when you're not in motion because you have a broken pelvis, you're going to die.
Mhm.
Like, it's red lights and sirens. And so anything you can do to prevent breaking of the most important hinge point in the human body, that should be invested in.
100%. And so, because I know we're close to time here, so I want to start to wrap up, get to a few questions, be respectful of you and in the audience here. A couple quick things. So how do you approach this topic with your physician? If you're someone that's experiencing these symptoms or wants to be a little bit more proactive, what are those key things you need to say, or who do you need to find and actually seek out to get good care?
I think the best place to start is if you have a great relationship with your physician, see if that conversation is available. And if you're a woman listening to this, that could be your OB, it could be your family doc. Hey, I'm super curious about hormone optimization. And you will know immediately whether that doc is going to poo-poo it, or whether they'll like pander to you and say, yeah, no, we'll look, but really doesn't know what they're doing, or whether they're passionate about it. I think you have to find your person. But if somebody out of the gate is going to poo-poo it, that's not your person. And it may end up be that you choose not to pursue this for one reason. Maybe you have a history of estrogen-sensitive breast cancer. Maybe you have there could be reasons where this doesn't make sense for you, but you need to find someone to have this conversation. And if you can't find it with your OB or your family doc, just get on Google and say, the term would be bioidentical hormone optimization. So BHRT or HRT, but ideally bioidentical hormone replacement therapy. Wherever you're listening to this, there is somebody who is doing this. Start there.
In terms of monitoring levels in athletes, so pretty competitive athletes, competitive recreational runners, people just want to stay active, what do they need to do? Is this something that monitor on a yearly basis, or how does that process look?
It depends on whether you're getting to cruising altitude or maintaining cruising altitude. In the beginning, there's some monitoring and tinkering and checking levels. I mean, it just depends on how fast you can get to the right dosing, right rhythm, right cadence, right levels, right side effect profile, managing those kind of things. You know, I would say that on average, it probably takes 3 to 6 months to really get dialed in. Sometimes it can take as much as a year. Sometimes you get lucky right out of the gate. So getting to the optimal levels is thing one, and that can take some time and work. Then thing two is maintaining that level. And that tends to be pretty steady state, especially in your postmenopausal athletes, because the only hormones they have are the ones you're taking. So like, that's not changing. In that perimenopausal 40 to 55, there can be some like, well, I was at cruising altitude, but now everything's messing up because the ovaries are shutting down as nature is taking its course. And you might have to kind of course correct through that transition period. So that's how I would think about it. It would just depend on where they are in their life.
Right. Okay. And in terms of daily strategy, so if we think about replacement therapy and think about what are those things that we are really in control of, is it nutrition, is it sleep, is it mind, like what other things can we really prioritize in our life to make sure we're optimizing naturally?
Yeah, well, I will tell you, this is coming from a guy, and I want to be respectful of your listeners' time. I know we're coming up on the time. I have always been pounding the drum of diet, and I still believe diet is massively, important. But I have recently, as in the last 18 months, I have elevated sleep above diet.
Okay.
In my observation, especially amongst high performers, we tend to punt sleep, and we are grossly underestimating the impact of not recovering adequately. Mostly because of the hormone implications of being sleep deprived. Sleep is, in my opinion, of the utmost importance. You could have a perfect diet, perfect training program, perfect hormones. If you're not sleeping, you're going to lose.
Mm-hmm.
Now, if you can figure out sleep, then I think the next most important thing is diet. It's diet and exercise, not exercise. And yeah, if you can get to diet, no, you will out eat your running plan in 13 seconds,
Mm-hmm.
right? You cannot run your mouth. We all try. But a far more strategic use of our effort and resources and time would be, let's fix the diet, let's fight the diet that's right for you, that helps you feel the best, achieve the right thing. Then it's the right strength training, then cardiovascular training.
Mm-hmm.
Like, to me, that would be the order: is get your sleep, get your diet, get your strength training. Then how do you want to layer in the cardiovascular and the endurance over the strength training? How is it complementary? And sometimes those kind of do a lot of overlapping, and you can do some really, a guy like you, as smart as you, as talented as you, could probably weave them together where it's hard to tell, because there are components of cardiovascular and resistance and fatigue kind of all woven together.
Mm-hmm.
Yeah, but I think sleep, you really have to figure out the diet that's right for what your goals are. Don't sleep on sleep. And then I think most runners underestimate strength training. I think most women, I've created a lot of content on the benefits of women to strength train.
Mm-hmm.
And, you know, I don't know one human who doesn't want to be strong and powerful. Not one.
Right.
And the best way to demonstrate to yourself that you're strong and powerful is to actually be strong and powerful. And so you have to train in that way.
I love it. Yeah, no, I think it's funny too, when I talk about my population, I hear a lot of people that we talk about recovery, it's massage and foam rolling, but they rarely go to, am I getting enough hours of sleep? Like, those things make them feel better temporarily, but is actually setting the system and allowing them to come back healthy and stronger the next day.
Yeah, look, icing and cold therapy, massage, rolling, deep tissue, those are wonderful. But like, don't miss the forest amongst the trees.
Right.
I mean, you will spend as a human 1/3 to 1/2 of your entire time on this planet asleep.
Mm-hmm.
Think about that. If it's not the most important thing, I mean, somebody needs to explain to me. And the only thing that I would maybe move would be diet, but they're here, and I'm kind of like 51-49. I think sleep by a nudge is more important.
I love that.
Yeah, I think everybody's overlooking sleep. Maybe not for this crowd, but I think most people who consume alcohol are also underestimating its impact, specifically on sleep and metabolism at the level of the liver. I don't know that that's probably a super relevant to your crowd, but that's another area that I see all the time. People are like, oh yeah, it's only 3 drinks a night. And I'm like, yeah, no, that's fine, but your sleep sucks.
Mm-hmm.
And like, that's why.
Mm-hmm.
So
that's great. And I know definitely something everyone needs to explore into too. I think the nutritional side of things.
Always be auditing the diet, be auditing the sleep, be auditing your goals. Does my diet and training regimen, am I mapping, do my behaviors and my ambitions, do they map together?
Right.
And there needs to be a synergy there, I think. Otherwise, you know, you put a lot of work into it and you don't get the results, then it gets frustrating.
Right. Yep. 100%. And so if people want to learn more, and I think looking through your website, and I just continuously follow on LinkedIn too with the podcast, are there certain things that you put out in terms of content? Is the podcast the best place for people to dig in and learn a little more?
Yeah, I think it just depends on if people like to read or watch videos or listen. I have a podcast, we have a blog, I have a YouTube channel with, I don't know, a couple hundred videos. Brentwood MD is the YouTube channel. BrentwoodMD.com is the website. And the podcast is the Future of Medicine podcast on iTunes and wherever, several other, you know, podcast players. I don't do hormone optimization outside of my concierge primary care at this point, but I still produce tons of content so that you can be locked and loaded and know the questions to ask, be educated on thyroid going in to whoever your person will end up being with like what I would tell you to do.
That sounds great. And so, I want to say thank you. Usually with these topics, be honest, I'm very, very selfish with the things that I want to have on here because I know this will directly help me, help my people.
Yeah.
But I know you brought a lot of value today. And as always, every time we connect, I feel like I always pick up something from you. So I greatly appreciate that. But
yeah, you're welcome. It's my pleasure.
Yeah, just want to say thanks for jumping on here. Thanks for the audience for tuning in today. If you guys have any further questions, feel free to reach out to me or go on the Brentwood MD website and ask a question directly. I know you probably have a lot of things going on, but hopefully through this content today, you can have the right discussions with your doctor to better just optimize hormones and just see better results with your health and wellness moving forward. So once again, I just want to thank you for your time today.
All right, Garrett. Thank you so much, buddy.
Have a great one.
Take care.